Hello, we're here today to present to you our work on the Developing Mental Health Nurse Research Leadership through the 70 at 70 Senior Nurse and Midwife Leaders Programme. My name is Jane McKeown. I'm a Senior Nurse Research Lead within Sheffield Health and Social Care Trust, and I also work at the University of Sheffield in the Division of Nurse and Midwifery, where I'm a lecturer and a researcher.
Hi everyone, my name's Carrie-Ann Black. I work at South London and Maudsley NHS Foundation Trust in Child and Adolescent Mental Health, where I'm the Research and Implementation Nurse Lead. And thank you for joining us. We just wanted to take this opportunity, as Jane said, to share with you the NIHR funded programme called 70 at 70. So we're going to use this next 10 minutes to tell you a little bit about what the programme's about, the overall aims of the programme, but then we want to talk to you more specifically about the mental health cohort and introduce you to the mental health cohort within the programme. And finally, think with you about some of the themes of the work that we've been doing as a mental health cohort.
Okay, thanks, Carrie-Ann.
No worries. So, kicking off, what is 70 at 70? So in part it came about through the recognition of the 70 years of the NHS in 2008, and it was a collaboration of initially 70 senior nurses in the field of research from across England, and they were competitively selected. And the programme specifically focuses on enabling them to spend part of their working time on increasing nursing research capacity and capability, both locally within their trust and then nationally as a cohort. Currently, we have 63 nurses and midwives on the programme, and that's across 51 organisations in England. The award enables each nurse through this NIHR funding to dedicate 2 days a week till April 2022, so it's fantastic. It's a 3-year programme, and during those 2 days a week, the idea is that they're focusing on fostering a culture of research innovation in nursing, but also informing research priorities both locally and nationally within a nursing context.
So we want to just explain why the 70 at 70 is important, and we know that organisations that are research active achieve better levels of service user and staff satisfaction, and also improve service user outcomes. But we also know that research active nurses are kind of in the minority in the NHS, particularly compared to other professions such as doctors and allied health professionals. But when you think that 25% of the NHS workforce are nurses, then if you can get more nurses research active and research engaged, then you can improve research activity in the NHS. And I guess just to clarify, when we're talking about research activity or involvement or engagement, we mean a whole host of things. So it might be supporting nurses to support the delivery of research studies that an NHS trust is hosting. It might be about enabling ward nurses to feel more confident in recruiting service users or letting service users know about research. It might be about nurses starting to come up with ideas for research and helping them to collaborate with academics. And it might be nurses actually taking on clinical academic careers. So it's quite a broad range. So the aim of the 70 at 70, so by building research capacity, the National Institute for Health Research envisages that there'll be an increase in the uptake of training and research that's led by nurses, that will be generating and implementing robust research evidence relating to nursing and midwifery interventions. And a big part of the 70 at 70 is the collective, the hub. So we come together nationally as a hub of now 63. And we also have regional hubs, and we also have speciality hubs. And that kind of collective voice is a strong part of 70 at 70. So the programme offers just a real unique and innovative opportunity for clinical mental health nurses to develop their research leadership skills across 9 mental health trusts in Sheffield, sorry, not in Sheffield, in England, and Carrie-Ann will tell you a bit more about that.
Okay, thanks, Jane. So yeah, if we just take a look specifically at the mental health cohort, there's 9 of us in there, 9 nurses across 9 trusts, and you can see on the map there that we're really well distributed, I think, across England. We have a facilitator who is the wonderful Professor Fiona Nolan, who's a mental health nurse herself, and she is kind of a mentor and facilitates our hub meetings and helps. We meet really regularly to share what we've been doing locally within our own trust, but also think about work that we want to do as a collective of 9 nurses, thinking specifically about the mental health context. So if I move to the next slide, you can see, you can look for yourselves, I guess. Not everybody can be here today, obviously, but you can see a little bit of information about each of the 9 of us and where we're based. And it's really interesting, actually, because we're a real range of different nurses in terms of our research context. So we do have people in our cohort that are specifically research nurses delivering research. We have clinical academics, we have nurse practitioners, nurse consultants, and professional leads. So it's a really nice, diverse mix of individuals applying research in different ways. There's a range of objectives that we've identified as the mental health fellows in order to achieve the aims of 70 at 70. And these have been developed individually to meet the needs of each of our trusts, because obviously we have to think about our local context. But we also wanted to think together about what our shared objectives are. So we can't talk about absolutely everything that everyone's doing because we don't have time in this. What Jane and I did was just get a snapshot of everything that people are doing and then look for some themes around that. So we've developed 3 themes that sort of capture the collective work of the mental health cohort. And what we're going to do is share those 3 themes with you and give you examples from each one. So hopefully it gives you a sense of our collective priority and how we're achieving them so far.
Okay, thanks, Carrie-Ann. So I'm going to start with the first theme, which is, we've called it support and stretch. And that refers to the kind of the work activities that we've each undertaken to both support nurses at various stages in their career to be able to become more involved in research. It also refers to the idea that we've looked to create opportunities for individuals to be stretched in terms of their development, and more specifically their research development. So we've got 3 examples of that to share with you. So some of the group, some of the 9 of us are looking at developing research placements for student nurses while they're on the clinical placement. So they'll be on their clinical placement in a mental health trust, but we'll offer opportunities for them to get involved in the research departments or perhaps the quality improvement audit departments, just to help them understand research, I guess, within the NHS context. We're also, some of us are looking at embedding research and evaluation learning into preceptorship programmes. So to try and engage and inspire nurses really early in their career in the trust, and to help them to understand what their role in research is. And some of us are looking to review job descriptions of nursing, just to ensure that across the different bandings, people are kind of understand what their research responsibilities are and are perhaps supported to have some time to do that. So I'll move on to the next theme.
Thank you. So we've called our second theme systems working. And this was another key theme that's about creating systems change and working across systems, because none of us can do the work that we do in isolation. We need to be working with our colleagues to create sustainable change and cutting across different systems. So just a couple of examples of that. One of them is a number of us are working with our HR departments, looking at how research involvement can be part of performance and development reviews and and seen as part and parcel of that. We're also looking at how the impact of being nurse research active can, how it can impact on recruitment and retention, and how we might be able to measure that. Another example is where one of our colleagues is working with 2 non-mental health nurses to identify research priorities within community nursing. So there's the cross-collaboration working going on there. Another example is that some of us have been leading research partnership programs that involve service users, so working across systems with our service users so that they can get involved in research. One example of this is inviting a service user to collaborate on funding for a research bid, and that's led to then a group of service users being trained and supported to undertake research as part of that project team. So it's not about us working in isolation, it's working with lots of other service users, other nurses, other disciplinaries as well. So that's just a few examples there of systems working. So if Jane wants to do the last theme.
Yeah. So the last theme is about shining a light, and that's it refers to awareness building, and it also refers to I suppose our roles to showcase where nurses are playing a part in research, and to kind of advertise opportunities for nurses to take part in research. So again, we've got some examples of that. So 3 of the cohort were successful in securing BDEP funding for a study exploring the experience of care receiving and caregiving in community mental health teams during the COVID-19 pandemic restrictions. And that's the study that Carrie-Ann gave the example of before, where we're involving service users as partners in that research. Another example is supporting nurses on postgraduate courses to share their findings within the trust in an annual research poster event. So making sure that the work they're doing on their master's dissertations, for example, gets shared within practice. And our final example is inputting into mental health nurse student programmes at a local university. So one of our cohorts doing that again to help the student nurses understand research, I guess, as it happens in the NHS, but also in helping them to look at their own small pieces of research and organising a research conference.
Oh.
So,
no, I was going to say, Jane, do you want to share that last slide with the email addresses on?
You can tell we've rehearsed this really well, haven't we?
Yeah, seamless.
So we just want to share the last slide with our email addresses, and then we're going to stop the presentation. And yeah, there we are.
Yeah. So we just thought we'd just before we kind of just wrap up, it might be nice to just share some of our own personal reflections of being part of this programme. So do you want to start, Jane? Tell us a little bit about, for you, how it's been part of 70 at 70?
Yeah. So I think for me, the one of the really valuable parts is being a part of a big cohort of other nurses. And I think that's really helped me to kind of, I suppose, ignite my passion for nursing. I guess I've worked in a lot of roles where perhaps I have been a nurse, but that's not been central to what I do. And I've not always, for the last few years, worked directly close with nurses. So just having that kind of cohort, and I think sort of a year and a half in, we're really starting to see how that collective voice, the strength that can have. So that's been really important, and I guess just having time to do what I really enjoy doing, which is sort of trying to inspire research nurses for the future. So yeah, there are a couple of the highlights for me. What about you, Carrie-Ann?
Lovely. Yeah, I guess it's very similar. It's just that the 2 things I'm really passionate about is nursing and research. And it feels like such a privilege to be able to kind of bring those 2 together and have that dedicated time to think about them. It's a bit of a dream opportunity, really. And to be able to think about it specifically in relation to mental health as well. So having our cohort together and being able to sort of lift my head above kind of what's happening just locally for me and my trust, and be able to get a sense of what's happening more nationally. It's been, yeah, absolutely wonderful. Yeah, I don't want April 2022 to come. I don't want it to end, to be honest. But so I guess that's our time up now. We're looking at how we can evaluate NIHR 70 at 70 as a whole, and for us as a mental health hub, we're looking at how we could potentially do an impact evaluation. And we'd love to come back and share some updates with you at future events. You've seen our contact details, and genuinely invite you to get in touch if you'd like to know anything more. But I guess for now, we just want to say thank you for watching, and yeah, take care, everybody.
Yeah, bye.
Bye.